Good afternoon, everybody. I welcome to this UCL lunch hour lecture on the impact of England's calorie labelling policy on individuals with eating disorders, past, present and future. My name's Professor Lucy Serple. I'm Professor of the Psychology of Eating Disorders at UCL and also Clinical Lead for Adult Eating Disorders at North East London Foundation Trust. I'll be chairing today's lecture. And it's a great pleasure to introduce today's speakers, Nora Trompeter and Yvonne Dirks. Nora Trompeter is a research fellow at the Institute of Child Health, which is part of UCL. She has a background in developmental psychology and she completed her PhD in 2022 at Macquarie University in Australia. Her research is focused on identifying social and emotional risk factors for the development of eating disorder symptoms in adolescents. Yvonne Dirks is research fellow at the Research Department of Behavioural Sciences and Health at UCL. Her background is in health sciences, psychology and clinical epidemiology. And she completed her PhD at Erasmus Medical Centre in Rotterdam in the Netherlands. And her research is focused on the development of eating disorder symptoms in adolescents and on identifying shared risk factors between obesity and eating disorders. Before we begin, I wanted to let you know that we'll have some time at the end of the lecture for questions. The way those are submitted is by at Slido. So if you type into your web browser sli.do, then that will take you to the Slido website, and then you need to type in the event code, which is #labels. That will take you to a list of questions that people have already asked. You can enter your questions at any point during the talks, and we will then, I'll chair the questions when the presenters have finished. So I always find it useful to type in my question as I think of it. So that can be during the talk, it won't disturb the presenters. And then, like I say, I'll be chairing at the end. And so I think that's everything that I need to tell you. I'm now going to hand over to Nora and Yvonne to begin their talk. Thank you.
Thank you, Lucy, and thank you for this wonderful introduction. Today, Nora and I will be talking about England's calorie labelling policy and how this might affect individuals living with eating disorders. So to give an outline of our talk, we will first start with explaining what the calorie labelling policy is and why this has been introduced. Secondly, I will also explain how this might affect people living with eating disorders. And then from there, Nora will continue focusing on what the evidence says about that, the scientific evidence, and what the next step forward could be from there. So what is the calorie labelling policy and why has this been introduced? So the new calorie labelling policy was introduced in April 2022 in England as part of the new policy program from the government to tackle obesity. And this requires large businesses, so restaurants and cafes with over 250 employees, to display calorie information on the point where the customers make their food choices. So, for instance, on the physical restaurant menus, but also on ordering screens of, for instance, fast food chains. Also on online menus and food delivery platforms such as Uber Eats and Just Eat. Businesses can also are also permitted to provide a menu without calorie labeling information, but only if this would be a request of the customer. So why is there calorie labeling on menus? And this has been a public health policy to tackle overweight and obesity. And overweight and obesity is a major public health concern in the UK, as at the moment 64% of the adult population of the UK is living with overweight or obesity. And as you can see in the figure, there has been a dramatic increase in the rates of overweight and obesity in the UK. So going from 53% in 1993 to 64% in 2019. Overweight and obesity are not affecting the UK population in an equal way. You can see here that overweight and obesity are more prevalent among those who are living in deprivation, among those who are living with disabilities, among people from minority ethnic backgrounds, and those with lower qualifications. And there are many adverse consequences of living with overweight and obesity. Physically, it will put you at risk for a number of diseases, including various types of cancer, type 2 diabetes, coronary heart disease. And we've also seen from the COVID-19 pandemic that people with overweight and obesity are more severely affected with an infection and have a higher risk of mortality. It can also come along with mental health problems such as depression and anxiety, which can, for instance, be the result of body dissatisfaction or other insecurities related to obesity. So the question why people develop a higher weight status and others do not is very complex. And there are many different risk factors involved, including a combination of genetics, environmental condition, and individual risk factors. But when we focus on the environment, and particularly on the food environment, this has been dramatically changed over the past decades. We now live in a so-called obesogenic food environment in which energy-dense, highly palatable foods are always readily available for you. They're very easily accessible, and they're also mostly cheaper compared to other healthier options. And public health policies aim to change the food environment can be divided into bottom-up and top-down policies. And bottom-up policies are policies that are actually changing physically the food environment for everyone. So examples of these are the sugar tax that has been introduced on soft drinks, and also the ban on buy one, get one free on junk foods would be a bottom-up policy for the food environment, to change the food environment. The top-down policies are providing people with more information to make healthier food choices, but it puts the responsibility on the individual. So for examples are the traffic light labelings on front of packs, and the calorie labeling on menus is also considered to be a top-down policy. So what should the calorie labeling on menus do? It should drive people to purchase and consume less energy. It should educate them about a high energy content of some foods in restaurants. It should reduce maybe the amount of times that people eat outside in restaurants, or make them choose healthier options when they go out to eat. It should also lead to a reduced energy intake before or after eating out. And ultimately, it should also motivate restaurants to provide healthier meals, so containing less calories or less energy, or reformulate their meals into less containing calories. So England is not the first country or the only country in which calorie labeling has been introduced. Other countries such as the US, Canada, and Australia have also implemented mandatory calorie labeling. But what is the actual evidence of calorie labeling policy? Is it actually reducing the calorie intake or the calories being purchased by people? And so far there have been 2 systematic reviews conducted, and their conclusion was that their overall evidence is very limited. They concluded that some of the studies observed a decrease in the amount of calories that are purchased, and one of the reviews made an estimation that this would be it would reduce the energy intake by almost 8%. And there is also some evidence that food outlets and restaurants are reducing their calorie content based on this calorie labeling. But the overall conclusion is also that the quality of the studies that have been conducted so far is low, and that there should be more high quality studies, and particularly in real world settings that are needed. So how might people with eating disorders be affected? The calorie labeling on menus might have some negative impact on those who are at risk of eating disorders, or who are currently living with eating disorders, or have lived experience of eating disorders. And eating disorders are currently affecting 1.25 million people in the UK. So to give you a little bit of background on what eating disorders are. So eating disorders are disorders that are characterized by severe disturbances in eating and food intake, and those are accompanied by distressing thoughts and cognitions and weight control behaviors. There are three typical eating disorders, being binge eating disorder, bulimia nervosa, and anorexia nervosa. And binge eating disorder is a relatively new disorder. It's the most common eating disorder, and there are the least gender differences within this disorder. And with binge eating disorder, people are experiencing binge eating episodes at least once a week. And binge eating episodes are episodes in which people are consuming a very high amount of food within a short period of time, and while they are also experiencing loss of control over their eating. So they have the feeling that they cannot stop eating. Bulimia nervosa, people who are living with bulimia nervosa also have those similar binge eating episodes, but they are using compensation strategies to reduce the effect of their food intake. So they would use purging or laxatives. And then finally, you also have anorexia nervosa, and that people living with anorexia nervosa are having severe body distortions and an extreme fear of weight gain, and it's often accompanied by a low weight status. So there are many physical consequences of eating disorders as well. For anorexia nervosa, this is all related to starvation. It impacts your growth, your organ functionality, and your bone density. And for binge eating disorder, a lot of people are also living with overweight and obesity, and are having those physical consequences that I've explained before. Overweight and eating disorders are very difficult to treat once they've been fully developed, and they have one of the highest mortality rates of all mental health disorder. And that's not only because of the physical consequences, but also because there are many suicides involved. Eating disorders are affecting young people disproportionately. The mean age of onset of eating disorders worldwide is now estimated to be 15.5 years old, so very young. And the incidence, treatment rates, hospitalizations are rapidly increasing in the UK. So in the UK, 32 to 42%. There was a 32 to 42% higher increase than expected during the pandemic among adolescent girls. And between the NHS published that between April and December 2021, 10,000 children and young people started treatment for eating disorders. And next to the full eating disorders, disordered eating symptoms, so subclinical levels of eating disturbances are also very common among children and young people. And those are very worrying levels, and young people who are experiencing this are also at a high risk to develop full eating disorders. So how can exposure to calorie labeling on menus have potential negative consequences? So the focus on calories and weight reduction might increase cognitions and behaviors that may result in disordered eating, including the preoccupation with food and calorie counting, body consciousness and body dissatisfaction levels may increase, and it may also promote unhealthy dietary behaviors that are not sustainable, such as skipping meals or severe weight control behaviors. And this may be particularly harmful for people who are at risk of eating disorders, for instance, people who are genetically vulnerable or living in sensitive age periods, such as adolescents. And it may also have a negative impact on people who are currently living with eating disorders or have had eating disorders in the past, as it may impact their recovery, and it might potentially also trigger relapse. So this is why this new policy of calorie labeling on menus has attracted a lot of concerns from public health, mental health professionals, and eating disorder charities such as Beat Eating Disorders. And Beat Eating Disorders has stated that the focus on calorie counting, which is often a strong compulsive component of eating disorders, may harm people with eating disorders, as it might cause anxiety and distress in restaurants, and it might hinder their recovery. So, because one of the key elements sometimes of treatment is that it would allow someone to eat without looking at the calories. So, in fact, 95% of the people who are living in Scotland with lived experience of eating disorders state that this will have a negative impact on their lives, according to Beat. So these concerns have also received a lot of media attention, but we want to know whether there is also some scientific evidence showing that calorie labeling would potentially be harmful for people living with eating disorders. And Nora will talk more about this scientific evidence. So I will hand over to Nora at this point.
So thanks, Yvonne, for giving such a comprehensive overview of not only what this calorie labeling policy is, but also why it might have negative impacts on individuals with eating disorders. And some of you may have come across these labels. You may have heard about people expressing their views on whether they find this helpful or harmful and how it might relate to their eating practices. But for us as researchers, we are really interested in understanding what is the evidence behind some of these reactions, is what we expect to happen actually happening, and how are people with lived experience of eating disorders experiencing this policy. So I now want to turn to presenting some of the available evidence that we have on this. So to do this, I want to present some findings that we have from a systematic review we conducted just a few months ago. So that means we systematically looked through all the literature that's available to date to see what have people found, and really kind of combine that to get a good sense of what we know, but also on what we don't know yet. So we focused on studies that were either qualitative or quantitative, but they had to look at the impact of some type of out-of-home nutritional labeling of food or beverages. So that includes the calorie labeling policy that we currently have in England, but also other systems. So it might also be, for example, some countries have implemented a traffic light system similar to the food packaging, but for out-of-home foods. So they were included as well. And studies had to report some outcomes relating to eating disorders or disordered eating. We didn't include studies if they focused only on prepackaged food, so the foods you find at the supermarket, but they had to be specifically in the out-of-home sector, so in restaurants, fast foods, cafes, and they had to report at least on some level of disordered eating or include people with eating disorders rather than just focusing on weight outcomes or consumer behavior. So you can kind of see our search strategy there, but you can see the kind of records we screened and where we included or excluded studies, but essentially we ended up with 16 studies in total that met our inclusion criteria and that we then looked at in more detail to determine what were the findings from these 16 studies. So the 16 studies we included were quite different in the methodology they used. So we had 5 studies that included some experimental design. So typically they would then present people with, split people into 2 groups, and one group, for example, saw a menu with calorie labels and one group saw a menu without calorie labels. You compared them. There were also some studies where calorie labels were introduced, for example, in a university cafeteria, and they asked people questions before this was introduced, and then say 2 weeks after to kind of see what were the differences in people. Then we had 5 studies which were cross-sectional studies. These were like your typical survey studies where you ask people a bunch of questions on whether they've noticed calorie labels, whether they've changed their behavior with calorie labels, and what they've thought about this. So you may have participated in some of these studies before, and this design might feel quite familiar. And then there were also 6 qualitative or mixed method studies. So these are similar to the survey studies I mentioned, but they had this focus on a qualitative aspect where they asked people to provide more in-depth information, either through a survey or an interview, talking to someone one-on-one, where they get, I guess, more in-depth information on what people are thinking. In terms of where these studies were conducted, so we, as Yvonne said previously, calorie labels are not unique to the UK, so they have been introduced in other countries, or similar policies are active elsewhere. So we did see a bit of an international spread there, but they were mostly in Western countries, so mostly in the US, Canada, or here in the UK, with 2 studies conducted in Saudi Arabia as well. All right. So firstly, I want to present a summary of the qualitative findings. So as I said, some of these studies asked participants more, I guess, in-depth questions about their experiences and got this, what we sometimes call rich data from participants. So what we did is we combined all of this information from the different studies to kind of look overall, what are the themes that are emerging? What type of things are people saying repeatedly? So what are some common threads, I get, what they're saying to then make sense of these responses? And we came up with 5 different themes of what people were saying the impact of calorie labels or other nutritional labels was. The first one of that was being drawn to calories. So they might say things like that they become hyper aware of the idea of calories. They imagine my body ballooning up. I feel dirty. So real kind of focus on this caloric intake of the food they were maybe thinking about consuming or were going to consume. Another theme that came up was facilitating the eating disorder. Respondents there may have said something like, it's definitely set my recovery back by a long way, and I only feel safe eating at home now. So this plays into a little bit of the kind of theory that Yvonne presented earlier about why this might have a negative impact on people with eating disorders, so that these calorie labels are, I guess, triggering or eliciting something in people that they are already struggling with. On the flip side, there was also a theme relating to reassurance. So here, a participant says, it allows me to go out and eat rather than having meticulously track my calories at home and guess outside. So this is more thinking about people who were, I guess, keeping track of their calories or finding it reassuring. It took some of the guilt away or made them less anxious because they knew what they were consuming when they were presented with labels. The next theme that came up was really relating to social eating. We were really thinking about eating out in particular being a very social practice that we often engage with when we meet up. When we meet up with people, it's often to consume a meal. So this participants here reported a lot of negative impacts on their lives. So here someone said, one thing the eating disorder loves is isolation, and eating out is a more popular thing to do with friends at my age, and now I don't go out. And specific to the UK context, we also saw a theme emerging of frustration. So this was mainly frustration at not maybe being listened to or being heard about the concerns that people had around this policy. So a participant here voiced, for example, that if it's detrimental to people affected by eating disorders, then what's the point? It being the policy. So you can kind of see from this picture that there are a lot of different responses people are having to the policy. Some of these are negative, some of these might be more positive, and we can see them there evident in different aspects of people's lives. In terms of some of the quantitative evidence, so I just want to highlight this one study that we can see here. So this was actually an eye tracking study that was conducted with people, and people were split into groups of whether they restrict their eating or not. And they saw, you can't, it's not as clear, but hopefully you can see this a little bit. So the menu on the left is the people who restrict their eating. And the menu on the right is one that's viewed by people who don't restrict their eating. And you can see that the people who restrict their eating pay a lot more attention to the calories than the people who don't restrict. And this is, again, kind of mirrored what we just saw in the qualitative findings as well, where people say they're really aware of these calories or really pulling their focus to it. So we can also see this supported in quantitative evidence that people who have problems with disordered eating do pay more attention to these calories. And in survey studies, this was also supported in that people who said they engage in disordered eating also said they use the calorie information more frequently than people without disordered eating, and they tended to use this information to select lower calorie options. So we can see kind of a thread throughout these different studies that there really seems to be a focus of people with eating disorders or disordered eating on the caloric intake. And this is different to people without disordered eating. Okay, so that's a little snapshot on kind of what the evidence at the moment is telling us. But you can see that this is still quite limited in what we know about the impact of calorie labels on people with eating disorders. And with any type of public policy that's designed to, especially one with this calorie labeling that is designed to support people's health, we do need to really understand any potential harms it's causing as well, and who it is causing to, and the extent of these. And the first step for any of this is to build an evidence base. So We do know a little bit already about this, as I just talked about, but we still need a lot more information. So that what I just presented is what we know already, but there are some really important gaps. And one really notable one is that none of these studies have included people under the age of 18. So no studies have been conducted with children or adolescents. And as Yvonne was saying, eating disorders do tend to develop in adolescence. So we're not capturing the impact of people at that stage of their development. And also importantly, young people might be vulnerable in really different ways compared to adults. They might eat out differently than adults. They might view calorie label information differently. So the impact of one policy may not be the same if someone's an adolescent or a child as opposed to an adult. Another gap in the existing studies is that a lot of these focused on restrictive eating. So people who limit the amount of food they eat or try to eat less. And while this is a really important focus and we need to know about that, we don't know a lot about people who engage in binge eating, for example, and whether the impact on those people is different. And here, some of the evidence that we have on this, as I said, there's not a lot, but some of what we do have is saying that maybe people who binge eat actually find calorie labels more helpful and it has a more positive impact on them. So by not including them, we're not getting the full picture. And lastly, the other thing we've noticed as well, so in our study, as I said, we in the review, we would try to be inclusive of different types of policies, but most of them were focused, had a calorie label policy like we have here in England, but we know that there are different policies out there, and we don't really know a lot about how they compare in terms of their impact on people with eating disorders. So we don't know if there's a way of presenting this information that may be more helpful or if there's a way that's less helpful. So knowing not only what each policy is doing, but how policies compare as well. All right, so to counteract that or to address that, we are both, so Yvonne and I are both involved in two separate research projects which are really designed to address some of these questions. So on our team, which includes Lucy, we're looking at the impact of calorie labeling policy on individuals with eating disorders. We are specifically looking at people who have lived experience, including young people, but also their parents and carers, and also asking clinicians. So two groups we haven't heard from in this conversation, and their experiences and insights. And we're also looking at conducting mixed methods study online for people with lived experience, including subclinical symptoms, to try maybe better understand some of the differences in why some people are impacted more than others, or the different types of impacts. Yvonne's team is also doing some great research on the impact of calorie labeling policies, specifically in children and adolescents, which includes both the use of focus group discussions and online surveys to really understand how children and young adolescents perceive these policies and how that is affecting them. So hopefully we will have some more answers to these questions soon, and we can really start to build this evidence base, because at the moment there's still a lot we don't know. So thinking more broadly, building evidence is obviously a really important first step, but thinking more globally about how can we think about these type of policies and how can we align these two fields of obesity prevention and eating disorder prevention. And one avenue for this that we haven't explored yet haven't explored today is the use of bottom-up policies. So Yvonne mentioned at the beginning that the food environment could be manipulated in two different ways, a bottom-up or top-down. So the calorie labeling is our top-down approach, and it places a lot of focus on the individual, and that is maybe something that in the context of eating disorders can cause some harms. When we turn to bottom-up policies, they tend to focus on the food environment rather than individual food intake or individual behavior. So they might be less harmful to people with eating disorders. And indeed, there was a recent study conducted in the UK that compared the acceptability of these policies in people with eating disorders compared to people without eating disorders, specifically looking at UK policies. So there were 3 policies proposed. Some of them have been implemented, some are yet to be implemented. And the 2 bottom-up policies being considered is a ban on advertising of unhealthy foods, drinks online before 9 p.m. on TV. So this is really kind of designed to reduce advertising for foods, especially at times where children might have them. So this is similar to other kind of health policies where you reduce advertising. The second one is a ban on the buy one get one free deals for unhealthy foods and drinks. So again, something that both policies that are designed to kind of change the food environment. And when people were asked whether these policies would make their eating disorder symptoms better or worse, only around 2% of individuals said that these bottom-up policies would make their symptoms much worse. And most people said it wouldn't have any impact on their eating disorders. When we compare that in the same study, they also asked that questions about the calorie labels on menus, so the current policy in place in England. Almost 30% of participants with an eating disorder said it would make their symptoms much worse. So that's one of the a few studies that we have where we're actually comparing different types of policies to kind of see the different impacts. Of course, we need to know much more about this, but in thinking about how to combine these fields going forward in terms of next steps. All right, so a lot of information and a lot of content, but I think what we're really trying to kind of summarize here is that going forward, hopefully there is a coming together of fields between eating disorders and obesity prevention. We can build an evidence base for existing and new policies to both looking at the intended benefits, but also potential harms, and ensure that any policies, any public health policies are safe for people. And to achieve this, to really bring the 2 fields together and work on this collaboratively to provide better policies for people going forward. I think that is all we have. So we'll have some time for questions. But if you do want to know more about any of this content or any of the studies I mentioned about the research we have planned going forward, do feel free to contact us as well. And I'll hand it over to Lucy.
Thank you so much to both of you, to Nora and to Yvonne, for a really fascinating lecture. It's so great to see collaboration between UCL researchers working in eating disorders and in obesity, as there's a bit of sometimes feeling a bit disconnected from one another. So it's really lovely to see you two working together and speaking together. Please do continue to put your questions in the Slido. So you need to go to sli.do and use the tag labels. I'm just looking at the questions. There are a few questions. I'll try and cluster things together so that we answer as many as possible. There's a few questions sort of hinting at the idea that for some people with eating disorders, calorie labeling might be actually helpful at certain stages of recovery. Would either of you like to comment on that? Maybe that's slightly more for Nora.
Yeah, thank you, Lucy. I'll get started with that one. I think that's a really good question and a really important one to answer. And I think we're only just scratching the surface in understanding that. I think a lot of the initial research really looked at, is there a difference between people with eating disorders and those without? But if we're looking at people with eating disorders, they're not just one group of people. They have very different experiences, and we need to think about who is impacted how. And I think one of the things there is that some people might find this helpful. So I think I mentioned before that people who engage in binge eating might find calorie labels helpful, but also people at different stages of their recovery. So as I mentioned in the qualitative studies, we did find a theme around the reassurance. So if people are maybe starting to recover and the concept of eating out is still very scary and overwhelming, it can be really helpful for people to have the calorie labels to reassure them or to take away that maybe guilt or anxiety. Whereas other people might find it less helpful or find it that it sets their recovery back. So it's really complex, and I think it'd be good for us to understand that a bit better.
Thank you. Yeah, I certainly have patients who find it reassuring, I think, that they can eat out if they're kind of currently trying to restore weight on a kind of calorie counting kind of plan. So I think it's really important, isn't it, that the research is designed in an unbiased way to ask about both benefits and difficulties. There are quite a few questions asking about trying to balance the potential costs and benefits of the strategy. One person's asking that saying that their patients who are living with obesity are really keen on having calories on menus, and how do we kind of cater for both people with eating disorders who might be harmed and people with obesity who might find this really, really helpful? Maybe Yvonne, do you want to start off by answering that one?
Yeah, I think that is a very nice summary of what the discussion is, and it is very, very tricky if it seems like we have those counter effects for people living with obesity and people living with eating disorders. And for what I would always think is that when a public health policy is introduced, it first of all shouldn't provide any harm to any people living within our society. And therefore, it's very important to first evaluate whether this might be the case. But again, there is it's very nuanced, and what might do good for some people might not do good for other people, and that debate will always be there, I think. But I think there are also a lot of shared factors for obesity, shared struggles for people living with obesity and people living with eating disorders. And I think that there are also definitely a lot of possibilities on providing policies or implement some prevention strategies that would have a beneficial effect for both people living with obesity and eating disorders. So
thank you. And of course, these two populations overlap, don't they? It's not just that these are separate groups.
No,
Nora, did you want to add anything? Sorry, I'm sorry, Yvonne, you hadn't finished. Please carry on.
There are a lot of people who are living with overweight or obesity, but also with eating disorders. So there is quite some overlap there. Yes.
Nora, did you have anything to add?
No, I think Yvonne summed this up really nicely, but yeah, I think this kind of speaks as well to the importance of the fields coming together and really working with one another and working with people with lived experience from both groups to find ways to provide policies that are helpful for maybe both, or at least not harmful to one group over the other. And yeah, I think especially going forward, focusing on kind of targeting shared factors could be really beneficial for that.
Great, thank you. Then there are a few questions that are asking about how people with eating disorders respond to nutritional labelling on packaged foods, and whether, I know that's not specifically the topic of your research, but whether you can say anything about that.
I'll start. I think it's a really good question. It's a really tricky question. I'm not overly familiar with the literature, but also not aware of too much literature looking at it specifically with packaged foods. So I think it would be also really interesting to kind of see what is the difference between the impacts of going to the supermarket and buying something where you have calorie labels, and then maybe going to a cafe and grabbing some food where you have calorie labels. Is that different, or why is it different? I think one of the aspects that when we're speaking to people about this is really with eating out, it's such a social phenomenon, and it's really different than if you're going to the supermarket to buy your groceries. So I think that social aspect of it is just one of those things that, and we kind of saw that in our qualitative research, that is something that's really impacted. And that is potentially something that's maybe really upsetting to people with it, which you wouldn't have in a supermarket.
So it might be that it's really negatively impacting people's social connections, which we know are really important when you're trying to recover from an eating disorder, if people don't feel comfortable going out to a restaurant.
Yeah, absolutely.
And I've certainly had conversations with people about, you know, choosing whether you go to a small restaurant, which doesn't have to have the calories labelled on the menus, versus going to one where you know the calories will be there, and what works best for people at different stages of recovery. Okay, just looking at the questions, please keep them coming. I'll get through as many of them as possible. Okay, so there are some, right, let me just have a little look. So we talked about packaged foods. Okay, yes, so a question specifically about the opt-out aspect. So we know that it is possible to request a menu without calories, and somebody's asking whether that is enough to mitigate the potential risks. And I don't know if you've got any knowledge about whether people do ask for those calorie-free menus.
That is a really great question, and I don't know whether they do ask for that, but I think that could also be perceived as a hurdle, stating, like, expressing that you're basically having difficulties with the calories on the menus. And I think that might definitely be also an aspect for people living with eating disorders to, you know, be an extra effort and be something that's also showing the environment that you might deal with that, or that it might be difficult for you to cope with calorie labeling on menus. So I don't have any updates on or data or any scientific information on this, but that would be my point of view, basically. Yeah.
I was thinking particularly for people living in larger bodies, that to ask for a menu without calories might feel like a very difficult thing to do. I don't know if you've got any thoughts, Nora.
Yeah, I completely agree that the extra effort might be difficult for some people. I also think it also doesn't work for every food venue. So for example, like coffee shops where you go up and you see the menu, there isn't really that option to walk in and see a different menu. So just thinking about those different alternatives as well.
Yeah, it would be so good to ask actually about how often people are asking for those menus. I was just thinking about, for me, whether I would feel comfortable as someone without an eating disorder or an eating disorder history, whether I would feel comfortable going in and saying, can I have the menu without the calories, please? And I think I would feel, a bit a bit self-conscious about doing that. So, okay. So there's a question, I think, following up to what you were saying, Yvonne, about public policies and harms, and saying, you know, it's really important to understand any potential harms, but maybe it's unrealistic to expect that a policy would have no harms to anybody. I don't know if you want to comment on that.
Yeah, well, that is very difficult, I think. But I think this particular one, there has been so much concern raised that it's definitely worthwhile to look into this. Yeah, so I think there are a lot of policies, or there are potential harmful effects from other policies as well. But yeah, it's just a really difficult debate and trade-off, basically, that is up to the government to decide upon, and we are trying to provide the evidence for this potential harmful effect at the moment. Yeah.
Excellent. So another really interesting question. Do you think there may be an effect on prevention for people who are at risk? So does exposure to calorie labels increase the risk of people developing disordered eating? And is that one of the things that you plan to explore?
Yes, I think that's a really important question to ask. Not only how is it affecting people who maybe have a problem or have a history of it, but also thinking more long term. If someone's continuously exposed to calorie labels, does that kind of set them on a path that maybe triggers other behaviors that are then kind of spiraling maybe into a long-term eating disorder? And obviously that's a question that's much more difficult to ask, and we would need a lot more long-term data on this, which we often don't have. I know in our work we are trying to also include people who don't just have a diagnosed eating disorder, but also are experiencing symptoms at the subclinical level, to try and understand this question a bit more. But yeah, I think also kind of speaking to some of Yvonne's work, really thinking about how children and young people are thinking about these policies would be really important to kind of inform that.
Yeah, absolutely. Okay, so I'm just thinking what else we've got here. Somebody asking about views on pace labeling. So pace labeling, for people who don't know about this, is labeling where it says the amount of exercise that would be required to burn off the calories in food. And I know that's on some packaging, isn't it? And I think it's used sometimes in the US. Are either of you knowledgeable about this?
I don't think there's a lot of evidence on this. So in our systematic review, one study was done on these kind of physical equivalent labels, but they had very limited focus on eating disorder outcomes. So there wasn't a lot we can learn from that. So I think it's definitely something to be explored a bit more. So I think, as we said, also, yeah, not just thinking about this particular policy, but other types of nutritional label policies, to see what are the impacts of those, and are there ones that are, yeah, particularly beneficial, particularly harmful.
Yeah, I think getting people into that way of thinking, where the idea is that when you eat something, you then have to burn it off by using exercise, is a particularly unhelpful kind of link for people with eating disorders, because of course we know that even if you're not doing any exercise, you need calories, you need energy, you need nutrients to just kind of, you know, if you were just lying in bed all day. And so this idea that, oh, well, if I've done this, if I've eaten this amount of food, I need to do this amount of exercise is pretty unhelpful, I would guess. But it doesn't sound like there's very much data on it yet. Okay. I was just thinking about this eye tracking study, and that it's such a lovely design, and whether we need to do more things like that. I was thinking about, you know, could this be a potential risk factor, people who spend more time looking at the calories than they do looking at the constituents of the menu, and whether that increases people's risk. That'd be lovely to do if you had the time and the money.
Yeah, absolutely. And yeah, I guess for it to have any impact in the first place, people need to notice it and see it and pay attention to it. So yeah, I thought that was quite a neat design as well.
Really clever. Yeah. Then somebody's saying, don't all individuals have the right to know what the nutritional value of their food is, whether they're living with overweight, obesity, eating disorders or not? An interesting question.
Yeah, I think people definitely have the right to know. I think one thing that we should keep in mind as well is that the amount of calories doesn't always reflect the nutritional value of a meal. So it would also be good, I think, maybe if the nutritional value in terms of how much fiber or how much protein a meal consists of would also be a very good way to provide information on what you are eating. Yeah.
And we know that the way that calories in food translates into the energy provided to the body is not simple either, do we? So we don't even know how helpful it is to think about the calories in a food, because it seems to depend a lot on how easy the food is to digest and, you know, how easily the body can access the calories.
Yeah.
Is my understanding as a non-expert on that aspect of it. We've got 5 minutes left. A couple of questions about sort of government and policy related. So one about whether other governments which have calorie labeling have done any of this kind of research or commissioned this kind of research on the impact of people with eating disorders, and whether there are things we can learn from them. And then somebody else saying that they understood that the government, UK government, and I think this is in England, isn't it, have already investigated the impact of calorie labeling and that's resulted in changes to the policy. I don't know if you'd like to comment on either of those.
I'm not aware of anything internationally, but that might just be because, yeah, just haven't come across it. I definitely know for the UK context, so that this policy is obviously in place currently in England, and the Department of Social Care and Research did also commission. So the research we're looking into is also funded by nationally to kind of look at these impacts. So they're definitely invested in this and knowing about this. The government in Scotland, Wales, and Northern Ireland are also considering these policies and are monitoring the evidence on them before making further decisions. I don't know where that is up to or what is happening, but that's just from a UK context.
So at the moment, the calorie labelling policy is only in England, isn't it? So if you go to Scotland, then there's no obligation to put calories on menus. Is that right?
That's right.
That's right, yeah. But speaking to people living in Scotland, for example, they have also reported that since this was introduced as mandatory in England, a lot of the chains do also provide the menus in their the same calorie menus in other parts of the UK. Yeah. So
right, because presumably there are lots of chains that are across the UK, and so they probably just have the same menus everywhere, right? And even before this legislation, there were restaurants that did include calories on menus, didn't they?
Yes.
Just, you know, chose to do it rather than being mandated to do it. Okay, we've got 3 minutes left. I'm just looking as to whether there are any last minute questions. I hope that I've tried to address pretty much all of them. We talked about prevention. We've talked about balancing the kind of costs and benefits for people from different groups. We didn't talk about young people and anything that would be a nice last question about what we know about how calorie labeling might affect young people as opposed to adults, both with obesity and with eating disorders. Either of you who would like to pick that one up?
So for young people, as I've presented, these eating disorders are typically developing during adolescence, and in the specific age group that we are looking at the moment, how they perceive calorie labeling on menus. we look at the age group from 9 to 13 years of age, because that is kind of the moment where children are like developing into adolescence, go into puberty, become more aware of their bodies, become more aware of societal influences of they might socially compare each other to one another in terms of their bodies, in terms of what they look like, their appearance. So we are very interested to see and hear how they are perceiving, whether they are noticing the calories on menus, how they perceive them, and how that makes them feel, and if that would be different for those who are having, for instance, trouble with their body satisfaction, so having a little bit of body dissatisfaction compared to children and adolescents who do not have that. So
wonderful.
yeah.
Thank you. I hope that you will both come back and tell us about the findings from the research that you are beginning to do now, because that would be fascinating. We need to bring things to a close. Thank you so much to the audience for your really interesting and useful questions. I just want to mention that the next lunch hour lecture will be on the 1st of February, and it's on the role of popular culture for queer teen identities formation in Netflix's sex education. So nobody can say that UCL isn't current in the sorts of issues it's thinking about. That sounds like a really fascinating topic. Thanks very much to Nora Trompeter and to Von Dirks for their presentation, and thank you to the audience, and we will see you again.